We're now live, Chair.
Thank you very much. And it's just gone 6 o'clock. So welcome everybody to the Adults Health and Social Care Scrutiny Board on the 30th of June. When the lights are still nice weather at the moment. So let's hope we can make the most of this evening. I'd like to make a special announcement tonight, and it's a special thanks to someone that's been with the authority for 9 years. And we'd like to say a special thank you to Ian Baines for all of his hard work. He's due to retire in 21 days and counting. So he's been a great support, a great asset to the adults team, and you will be greatly missed. So I'm very sorry to say goodbye to you. We will be saying that officially, but I'd like to make official notes on this board that we'd like to say our special thanks as a board and as councillors for all the hard work and motivation that you do to everyone else. So thank you, Ian. So let's get on to the agenda. So substitutes nominated for this evening, and apologies for absence. So we have Councillor Foster substituting for Councillor Kingstone, and we have apologies from Councillor Ford. I don't think we have anyone else. Everyone else is here. So welcome, members. Okay, item number 2, members' interest, to remind members to declare their interest at the relevant time. Item number 3 is admission to the public. We are on a live stream, so the members of the public can tune in and hear what we have to say and listen to our priorities for the year. So item number 4 is minutes of the Adults Health and Social Care Scrutiny meeting held on the 1st of June 2022. I take those as a correct record. Do I have a seconder for those? Thank you, Councillor Hutchinson. And all those in favour of those, please. Okay, thank you very much indeed. Okay, so we are going to item number 5, which is the public health priorities. Over to you, Debs. Thank you, Debs, for coming and agreeing to do this. And equally, Councillor, sorry, I've just lost you. Councillor Corney, welcome to the scrutiny meeting. It's really nice to have you on board and to listen to your views as well. So over to you, Debs, please.
Well, Councillor Courtney's going to actually kick off Councillor Blackburrow, so I'm just going to open the presentation. Just here we are. I think this is right. It's a long time since. So if I make this, oops, brilliant. Over to you, Councillor Courtney.
Councillor Courtney, you're on mute, unfortunately.
Yes, someone had to do it, and I'm happy for it to be me. So I was just saying thank you very much for having me here, and it's really lovely to be here. And I'd just like to talk very briefly about the priorities and what our priorities are going to be this year. Debs is going to talk about the mandated services and the public health recovery following the pandemic and Active Calderdale. So I'd just like to talk about the strategy and the corporate priorities, really. So if you want to go on to fantastic, thank you. So the wellbeing strategy is about living a larger life, and how I see that fitting in terms of my portfolio. And obviously I have a portfolio of public health and towns as well. And it's my sort of vision really is about how our towns are places, but more importantly, they're communities, and it's about people, and it's about the people that we have. So our general priorities obviously are around, and the council are about reducing inequalities and strengthening our vibrant towns and reducing the effects of climate change. And they all work together. I see that all under my, not that I'm responsible for the whole lot of it, but in terms of our priorities for the coming year, towns thrive or don't thrive depending on the people who live there and the people who work there and visit them and what they don't do. So building on the resilience and the kindness of people in our communities, we can empower people to empower people in those communities to make the towns that they want them to be. So working with them and sort of co-producing. So in our towns work, for example, we're working very much with local communities in order to make sure that we're delivering the right things. So I know this is about public health, not about towns, but that is really important, because if the towns are if people feel satisfied in their environment and they feel safe in their environment, then they're much more likely to be active, and they're much more likely to go out and be active in their environments. And being active is really, really important in terms of public health, in terms of people being healthy. It helps and it helps with the agenda all the way through our journey of life. So for young people, if they feel safe in their towns and they're satisfied with them, then they can go out and play, and it helps with the development of children through to adults, and living and working well and aging well. So it all fits in together with the wellbeing strategy priorities, which are on the slide that's up, and I'm sure you've all seen these lots of times. So things like, so we are looking, so we might be looking at things like active transport. We don't have the gift of being able to just snap our fingers and strengthen our public transport, but we'll be lobbying to help our public transport be better, so that maybe we can do things like change some of the behaviour around car use, which can then will help with air quality, for example, will also help in terms of delivering our climate change sort of priorities and strategies. So I think it's all about if we can all be, so it's just about looking at everything as a whole, looking at things really holistically. So looking at people and living healthier lives. And it all sort of fits in, as I say, with sort of towns and with climate change. That's, I think, what I want to say about in terms of sort of strategic vision. And I'm really, it's really exciting to be in lead for public health, because I've got such a fantastic team. So I'm going to hand over to Debs, who's just absolutely brilliant, and she's going to talk you through some of the mandated services that we do, and how we're going to deliver on these priorities and strategic things.
Oh, thank you, Kath, for your kind words, Councillor Courtney.
Councillor stop tour there.
Councillor Courtney's sort of outlined the sort of, the key priorities for the year, and obviously the wellbeing strategy, the priorities, and we want to be contributing to that, and as she said, to our corporate priorities. But I'm now trying to move the presentation on and struggling to do so. Oh, there we go. So I just wanted to say a little bit about what our priorities are for the coming year, and the first thing really to say is that the public health, we have a number of mandated services. So these are services that we must carry out. We get a grant from the government, a public health grant, and as part of the conditions for getting the grants, there are some services that we must undertake. And what I've done is I've listed them here, and you've seen the papers in advance, Chair, and Scrutiny Board members. So I won't go through them in detail, but these are the things, and some of these will be very familiar to you, that some of the services that you'll be well aware of. But there are some things in here that you might be a bit less aware of. So, for example, health protection. So that's not a service as such, as a function that we must do, and that's very much about the steps that we need to take to protect the health of the public. And this is something we must do, and we must do this in partnership with our local NHS partners, our own environmental health partners in the council, and also the UK Health Security Agency. And actually, most of what we were doing through COVID was health protection, just to give you an idea of the sort of thing that is. But most recently, a good example of this is the work that we've been doing in Todmorden, which you'll be aware of, with the we had a cluster of meningitis, a form of meningitis in Todmorden, and we decided to work with our partners to offer a vaccination to people aged 16 to 24 who lived in that area. And often that health protection work is a bit more reactive, so it's a bit more, we have to keep capacity in our annual work plan to be able to respond to some of those issues. And then the other bit that you may be a bit less familiar with is we've got a responsibility to provide public health support to our NHS partners. So that's about helping them think through what the health needs of the population are, what evidence, what works, and also supporting them with some of the preventative measures that the NHS takes. So I just thought I'd highlight just those couple. And then just going through the priorities that we've set for the year, which Councillor Courtney's mentioned already. The first priority is really about recovering the public health function from the pandemic. And we're a very small public health team in Calderdale. And what that means is that we've actually done the most of our time, the time of me and the time of my team has been spent on responding to the pandemic, which, as you know, was a public health emergency. You know, in bigger councils with bigger teams, they've been able to carry on some of their other work, but that's been a bit more limited for us. And so, because of that, it's really important that we take stock. We've taken stock and thought about how do we recover the public health function, because we're not going to go back to how we were before the pandemic. We are different as a team. The things we do are different. Our relationships with our partners are different now, so it's really important we capitalise on some of that. So what we've summarised here are the things we've put in our business plan that sort of focus on how we're going to recover our function, the public health function, and one of the things there is that we've launched a consultation on Tuesday of this week to restructure the public health team, very much learning on from the pandemic. And actually, the proposed structure that we're consulting with trade unions and staff on actually proposes to increase the staffing capacity of the public health team to ensure that we're a bit more resilient and a bit more flexible in the future. Linked to that, we're going to be doing what we call a zero-based budgeting exercise. So we're going to be looking at the money we spend, the resources we use, and thinking about how do we set budgets to help us move the money to where we need to really focus the resources to deliver the outcomes that we want to achieve for the people of Calderdale through our wellbeing strategy and our corporate priorities. So those two things really go together. It's about the resources, where the resources are. We're also refreshing the approach that we're taking to our joint strategic needs assessment, which is one of our mandated services. So that's very much about the joint strategic needs assessment, really helping us, really helping shape the decisions we make about people's health and wellbeing across the partnership. So we've been doing quite a bit of work to look at how we do that and how we get that joint strategic needs assessment really useful and really informing decisions that are made. We are also going to be working with partners, thinking about the recovery of some of those public health services that we know have been impacted by the pandemic, and particularly some of those preventative services, screening and immunisation, where we know that during the pandemic, you know, we have it's been difficult for us to ensure that everybody that can be screened gets that screening appointment and also immunisation. And then finally, I actually feel a little bit traumatised by the pandemic, but this is a little bit broader than that. This is really about, we've learned a lot actually during the pandemic about how we protect the health and wellbeing and promote the health and wellbeing of our most vulnerable communities. And so often trauma is at the heart of some of the challenges that people face. So we really want trauma-informed approaches to inform and be embedded right throughout all the services that we commission, the way that we work as a public health team. So that's that priority. In terms of the starting well priorities, and again, I'm not going to go through these in detail. You've seen the presentation. We're just going to pull out a few of the key areas that we're proposing to be working on this year. We've been doing some work around developing a new partnership around starting well, the children having the best start in life, and a real focus on children being ready for school and addressing inequalities in that. And associated with that, we've done some work with the nationally with the Early Intervention Foundation to look at where we are, where our strengths are, where our areas of development can be. And we're pulling all of that together into a Starting Well strategy. And that will inform things like our approach to family hubs, our work with early years settings, and we've also done a strengths and needs assessment as well, which can really help us inform our strategy. And again, there's quite a lot of detail talked about this work in the children, young people scrutiny session. So obviously there's that sort of crossover. We are looking to do some work. We know from speaking to our communities, we know that in the challenges in the pathway around speech, language and communication is really contributing to inequalities in children being ready for school. So we really want to get those services working for our children and families. In terms of developing well, again, there's a whole session looking at this at Children and Young People Scrutiny next week. But just to highlight a couple of things in here, we are looking to develop a Healthy Schools programme and an award, and that's on the agenda for Children's Scrutiny next week. That's really about enabling and supporting our schools to be healthy settings and really think about health and wellbeing right throughout everything they do. And we're really building on some phenomenal relationships we've developed and with schools through the pandemic, where we've been supporting them every day on a daily basis. And we're also doing a bit of work linked to that around affordable and sustainable food. And Councillor Courtney and the Children's Scrutiny Committee have done some work on school food. And I'm going to move on to the sort of the adults bit of the world now, which is I'll probably dwell on just a little bit more, if that's okay, Chair. So in terms of our priorities for living and working well, we are a key priority for us is developing a substance misuse partnership and system to really improve increase the capacity of our drug treatment services and system, but also the effectiveness of our drug services and systems. There's a national drug strategy that actually means that additional resources are going to be coming into Calderdale to scale up the services and improve the offer and the services, really focusing on improving outcomes, both in relation to recovery from substance misuse, from drug and alcohol use, but also harm reduction. And we've learned a lot, and I know this scrutiny board previously has given a great deal of thought and consideration and scrutiny to the burnt bridges work, and this is absolutely critical to that. We know that unfortunately still we have too many drug-related deaths in Calderdale, and this is a massive opportunity for us to get a much more joined up integrated system to really improve those outcomes and reduce harm. I think that for me is just one of our biggest priorities in the coming year, and again it may be something that the scrutiny board wants to explore in more detail at some point. We are also doing some work to integrate a range of health and wellbeing support for adults around our community anchors. So we have a number of services at the moment in our system that are helping people be healthy, help connecting people to supporting their local communities to be healthy, to help them sustain any changes they've made, and also to develop community-based opportunities for people to be healthy. And at the moment we've got quite a number of services that aren't necessarily working as one. So the idea of this piece of work is that we work with those services to create an integrated system, whether it's one service or just a system that's working collectively but effectively for people. That's going to be really important. You may be aware that our combined authority is developing, in the process of developing, a Fair Work Charter. And in that charter, there's quite a strong focus on workplace health and wellbeing. So I'm on the steering group of that initiative, and we've been contributed to the consultation on that. But what we want to be doing is really supporting our workplaces achieve that Fair Work Charter, so that we've got more people in Calderdale in good, healthy work. That's so good in terms of people health and wellbeing. We also are doing a lot of work, and a key priority for us is suicide prevention. And we've got a suicide prevention strategy that I know the board is aware of, and an action plan. And that's a key focus of our work for the coming year. Again, as you're aware as a board, unfortunately, Calderdale has more suicides than we should. We do have a higher than we should suicide rate. We're also going to contribute to the development of a food strategy, and we're also, as I've mentioned already, supporting the development of trauma-informed approaches. And then second to finally, in relation to our priorities, we are doing some work around ageing well. And Ian is heavily involved in this, so he was sadly missed in this work, developing Calderdale as an age-friendly place. So we're doing a lot of work so that we're a place where older people feel included, involved, welcomed, able to play their part in society and contribute. And we've done some fantastic work to understand what older people in Calderdale think will make a age-friendly Calderdale, and that's really informing the work that we're doing. And then finally, we're looking at using population health management approaches to look at preventing falls and promoting independence. And then finally, you'll all be aware of our Active Calderdale programme, which is a massive priority for us in Calderdale. So this year, that's an enormous programme of work, but this year there are some specific things that we're working in partnership with others through Active Calderdale. One of them is around developing parks and green spaces as health and wellbeing assets, making it easy for people to be active. They're free, they're there, people can use them for the health and wellbeing and to be active. We're also really keen to look at active travel and increase active travel. It's really important, links to our climate change, climate change priority as well. And also, you can see there, we are doing some work to develop a Calderdale air quality strategy. Again, that very much links to our climate change aspirations. We're in the process of developing a strategy at the moment, and again a delivery system for that as well. So they're the priorities, Chair. I was also asked, again, a fantastic suggestion from Councillor Courtney to sort of think about bringing some of this to life a little bit. So rather than in public health, we do commission some services for people, for individuals, but we also work with the whole population and with settings. So what I've tried to do is just give some more practical examples of some of the impacts of the work that we do. But I wanted to start by sort of talking through this triangle really briefly, if that's okay. So we work at three levels, if you like. Some of our services work with individuals. So, for example, our NHS health checks, they identify people at risk of getting a long-term health condition before they've got it, and then we can support them to reduce that risk so they don't end up getting that long-term health condition. And we've got some great examples of where that's happened, where people have been at high risk of developing diabetes or heart disease, and actually by being identified and then supported to be more healthy in various ways, that risk is reduced, and that's fantastic. And then the other example that we can give there is we've got a fantastic Staying Well service that sits in our community anchors, and really we've got for example, we've got a great story that we heard about somebody with long COVID, and who was most of the people we've heard from with long COVID unfortunately haven't had good experiences of getting support, but the people that were connected to staying well. They got really personalised support, got connected to support in the local community, and they've had really good experiences. Now, if we deliver really good services to individuals and every individual that can benefit from them gets them, that adds up to a population level impact, if you see what I mean. But it's still the services that are delivered to individuals, but that potentially can have an impact on a whole group or a whole population. The other thing that we do is work with what we call settings. So they're places like schools, like workplaces and communities. And actually, if we can offer that support to all of those settings, then we're delivering an intervention to a whole population. So there's a fantastic example that I think Councillor Courtney can probably bring to life better than me around the Halifax Academy Sustainable Food Project. Do you want to mention that, Councillor Courtney?
Yeah,
I know
sure.
you visited.
Yeah, sure. So we visited that sort of part of the work of the Food in Schools deep dive that I was doing when I was still part of the Children and Young People Scrutiny Board, and it was absolutely stunning, the involvement with the community. So they have a primary and a secondary setting. The primary setting, they have a kitchen where they make their own food. They grow quite a lot of their own food. They're very keen on they have a great salad bar that the children just help themselves to, which isn't, they're not the only ones in Colesdale that do that. That's relatively common. But then what they started doing, I think, sort of during the pandemic, and they work quite closely with the Outback, which is a food growing group, and St Augustine's as well. And what they were doing is they sort of wanted to be helping the families that were struggling sort of during COVID. And they started cooking food, and they found that they had a kitchen that wasn't being used. It was like a food tech room. And where it's at now is that they have a community kitchen there. They have volunteers who are parents, mainly from the sort of primary phase of the school. They sort of come in, start volunteering. Some of those parents have been put through NVQ and different accredited training around sort of health and hygiene, kitchen and catering, so actually that it can help them in a move to employment if they haven't been in employment. And the day that I visited with Councillor Tremaine, they were making, I think it was something like 250 meals that they were going to just give out, mainly free, on sort of primary school pickup for the parents that were coming to pick up their children in the primary phase. Although staff could also do a pay as they feel and buy them as well. And the whole thing had cost them £50 because they were working within the community, getting food either that was about to be thrown out, sort of like in that sort of junk food project sort of way. So food that was, that shops were sort of on the edge of not being able to sell, or just kind of getting donations from community-minded organisations and businesses, and creating these really delicious meals, healthy meals. But it's sort of like providing something for the community, but also upskilling the people that were involved in it. And the atmosphere in the kitchen was amazing. They were really happy, and it was just altogether just such an amazing, and as I said, they were growing food on site as well as having food donated. And those the food there is the growing is also used by the children. So the allotment, I suppose, allotment sites. Whether it's sort of gardening clubs or sort of science lessons and those sorts of things, but also a bit of time out for maybe some children who are struggling a bit in the school. So it's just all over. It just all works in a really integrated way. And I think all that the school had to do now, it's quite a large school. All they had to do was I think there's one person who was a cover supervisor who now is basically coordinating all of it. So it's not a huge resource. I mean, the school is located, they've got the room there as well, but it's not a massive resource that they're having to provide for so much added benefit throughout the school and throughout the community.
Brilliant. Thank you, Councillor Courtney. Knew you bring that to life much better than me. And I think one of the other examples I'd give in relation to a setting that's a little bit different is we know that we've got some housing settings in Halifax where we know that there are drug users, and we're actually working through that in that setting, working with the landlord's agent, and actually engaging with the drug users and supporting them to reduce drug-related harm. So we're supporting them improve their outcomes, get engaged, get involved, in a really holistic way. And again, I hope you can see from this that we don't do anything in isolation. We work with partners. That's very much what we do. Our job is to sort of engage and enable and support partners, everybody, to play their part in helping people be healthy. And then finally, I'll just give one example at a population level. And if I give the best example I think I can give there is the Green and Healthy Streets policy. And ideally, that's a policy that a lot of people will never see, never read, but actually it's informing the way that we make decisions as a council about streets, so that the healthy streets, so that the streets that enable people to be active, to feel safe, there are places, there's green space, there's biodiversity, they're attractive, etc. And we know that all of those things are really important to people's health, but that affects the whole population. So I hope I've given a sense of the different, hope that's made sense. I've given a sense of the different levels in which we sort of intervene. And then I was also asked to just do a little bit of an overview in relation to the budget. So again, we have a public health grant, as I mentioned at the beginning of the session of the presentation, which is ring-fenced to be spent on services and programmes to protect and improve the health and wellbeing of Calderdale residents, and we have to deliver those mandated services as well, which I mentioned earlier, and that's around £14 million for the year that we're in at the moment, as a sort of a core grant. And then what I've done here is just sort of summarise based on the sort of headings that we're working with through the starting well, living and working well, etc. So you can see there that there's about 1.6 million in our current budget for staffing, 22 for communications, etc. I won't go through it in detail. What I think you'll see here is that the biggest chunks of the budget are starting well, which includes like the health visitor service and contribution to children's centres, our contribution to the sort of public health midwife service, and substance misuse, the sort of drug and alcohol services, which again you can see is just under £3 million, and then sexual health services. So they're the big services, and mainly they're services that we commission from partners. But I hope that's useful just as context as well, to just give a little bit of an overview of the budget. And then finally, you'll be pleased to know, I just wanted to mention that we did, our audit team did a really helpful audit of the public health grant, of the use of the grant in the end of last year, beginning of this year, and this was really useful because, quite rightly, absolutely appropriately, some of the public health grant is used to support council services that really contribute to people's health and well-being. So things like contribution to libraries, contribution to as I say, to children's centres, contribution to some of public services, leisure services, etc., and which is really, really important. But one of the things that the audit said is actually what we haven't got, that investment has been made quite rightly, but we haven't got a sense of what that's delivering in terms of the impact on people's health. So there's a recommendation there that when we are investing, like we do when we commission services from providers, we gather data on what impact impact that investment is having. And there's a recommendation that we do the same for council services, so we're really clear about the return on that investment in terms of people's health. So I thought I'd just share that with you as a final point. And that's our presentation, Chair. So I'll stop sharing.
Thank you very much. Now. Thank you. Oh, that's better. Thank you ever so much there, Deb. So you have, from the day one you entered the council, you've been a breath of fresh air, and actually this is quite exciting to be supporting, and there is cross-party support to actually support the restructure, to actually ensure that actually you can do everything else that you need to do. It's our duty to help in any possible way, and we are doing tonight, and I guess in some ways, by having the meeting online, because actually the levels are increasing at the moment. So actually I took the decision that we'd have the meeting online. Just a few points actually. You mentioned about green spaces. At the moment we are blighted, and I will say blighted, with travellers causing disruption to green spaces. So I would very much welcome talks between yourself and Andrew Pitts to ensure that actually we can protect those green spaces so people can use them on a more regular basis. Councillor Courtney.
Just about to speak. Thank you. Yeah, so this is an interesting one. So this comes up in the police and crime panel on which I also sit. And I think my understanding is that in the local plan, we have identified or will be identifying a site, which is our statutory duty to do that. It is actually our statutory duty, which we are currently failing at the moment. And by doing that, we are actually criminalising travelling communities. And, so what we need to do is really get our act together, identify a site, create a site, and make it livable as according to our statutory duty. We need to do that, because when we do that, then we can also look after the health and well-being of travelling people whose outcomes are appalling. If you look at the stats in terms of health outcomes and stuff like that, they are a group of people, communities of people who have terrible outcomes in their and if we can provide, as to our statutory responsibility, a site for them, then we can be much more available and present in terms of being able to offer them the same sort of services as other people got offered around sort of maternity and health visiting and stuff like that. So actually, I think the issue around that is that we need to, as a council, get a site up and running, and then we can look at how we can actually help the population of travelling people.
Thank you, Councillor Courtney. That's helpful, useful information. The other point you mentioned, Deb, was the Fair Work Charter. So I'd be quite interested to look into that and put something in the work programme in relation to that and how that actually looks in reality. So that was really good. And the burn bridges, you mentioned the burn bridges in relation to prevention, suicide prevention. I think it's a key that we want to continue to focus on in relation to the burn bridges report. And helping us. So I'll bring in Councillor Hutchinson at this stage, please.
Thank you, Chair. Thank you very much for that report, Debs. You describe a refreshed approach to the Joint Strategic Needs Assessment, but I'm still not quite clear in my mind how that refreshed approach differs from the previous approach. I understand it's really important because it's supposed to form the key document to the place-based health system delivered through Calderdale Cares and others. So, obviously it's important that we get this right, but what do you mean by a refreshed approach?
Do you want me to come in, Chair, and respond to Councillor Hutchinson? I think what we've had is we've had a a really good, thorough joint strategic needs assessment that's been produced and put on our website, and it's a document, and then it's sort of there. And we don't really understand and know how it's being used, or beyond us using it. And actually, what we're keen to do is create something where the starting point is how people want to use the intelligence. So we make the starting point how the intelligence can be used, and what it needs to be like in order for it to actually influence decisions. So what we've been doing is we've been working with a range of partners to sort of think about what a joint strategic needs assessment would look like. So we're thinking here now about it being an online clickable thing rather than a document, it being a live information as well. That it, as well as including statistics and high level statistics about key health and wellbeing needs. It also includes information about the assets that we've got in Calderdale for people's health and wellbeing as well. So the things we've got that can be built on to enable people to be healthy, but also that we include in the joint strategic needs assessment what people are saying, what communities are telling us is important in terms of health and wellbeing as well. So the intention is, and it's early days, and that's why it's a priority for this year, but the intention is that what we'll have is we'll focus on our wellbeing strategy, so the starting well, developing well, living and working well, and aging well. And in that joint strategic needs assessment, we'll have a sort of a high level summary of what we know, what the data is, what the information intelligence is telling us is important in relation to each of those areas. And then able to click through, if you want to see the detail, the more detailed reports, you can sort of click through to that. But so that on that front page, it's quite easy for people to think about the decisions they're making and the things that they need to do and what the information and intelligence and voice and insight is telling us in relation to that. So that's sort of the vision, Councillor Hutchinson. What we've also done, which I'm really delighted about, is through that process, we've actually set up an analyst network. So the partners from across the healthcare and wellbeing system and the corporate bit of the council, there's a group of analysts now meeting together. And the idea is that group of analysts actually create the content of the joint strategic needs assessment. So rather than it be something that people in my team work very hard on and use, it's something that actually is populated by a range of partners. So that analyst networks means that we can avoid duplication, share skills, and also share data actually from different sources of data as well. But as I say, Councillor Hutchinson, it's early days, so you can let us know if we're succeeding in this when we've got that new approach up and running.
So for the time being, the Calderdale Cares will be working off the old JSNA, will they? Right. Okay. Thanks.
Thank you for that. Councillor Barnes.
Thank you, Chair. I think mine before I've got three sort of related questions, which is on the budget. But beforehand, slide 22, page 2, second bullet point. These agreements should be subject to periodic review by a responsible officer. Does this mean you have some irresponsible officers within public health, Debs?
I don't believe we have any, Councillor Barnes.
All right. I think I want to go back to the previous slide, which is to do with the budget. And three questions. One, does the staffing and associated cost, does that factor in the current reorganisation and restructure that you're looking at? Secondly, health protection, in particularly infection prevention control and health protection projects are very, the amount there is very low or looks to be very low. So I'd like a bit of comment on that. And secondly, can you explain a little bit more about contribution to council services? Thank you.
Over to you, Deb. Sorry, thank you.
Yeah. So yeah, absolutely. So yeah. I think we've got audit speak in the recommendations there, Councillor Barnes, for the first one. But yeah, in terms of the staffing costs that are included that we're proposing, the share of this year's costs of the proposed increased staffing capacity are reflected in that table. In terms of health protection, yeah, you're absolutely right that the amount of resource in there is relatively low compared to other areas, and that resource is largely our infection prevention and control service, which we've during the pandemic we developed an integrated approach to that, working with one of our community providers. It actually worked really well. Ian will be able to sort of comment on that as probably better than me, but that integrated approach worked really well, and actually we only had very limited capacity previously, so although it doesn't look a lot of resource, it's actually more resource than we've had previously. But in addition to that, I think we have in our staffing, we have in our proposed structure, we have a senior practitioner working on health protection in addition to infection prevention and control. I spend quite a bit of my time on health protection, and so do the consultants in public health. So while some of the resource that's in staffing is actually deployed to health protection, as well as the budget that you can see there, but it is, although yes, it does look low, it is an increase compared to previously.
Excellent, thank you for that response. Councillor Hutchinson, please.
Thank you, Chair. I'd like to just ask about two of the strategies that you're planning to develop. The air quality strategy. What process is that going through at the moment, and when will, say, this committee have a chance to comment on a draft of it? I mean, I'm assuming when we were going through debate on the incinerator in Sowerby Bridge, some interesting data was brought up about the prevalence of respiratory disease in the nearby communities or with in the registered practices. So presumably, if that's relatively easy to retrieve for Sowerby Bridge, it's also possible to retrieve for other parts of Calderdale, and would form a useful proxy for measure for the effectiveness of the strategy. You know, understanding the scale of the problem would be helpful, I would have thought, and also. You know, I presume it won't simply be looking at air quality issues related to motor vehicles, but we'll also be looking at things like wood burning and open fires. Concerns have been raised recently that with increasing price of gas and electricity, that people who have those facilities may be looking to use open fires as the winter comes on. But you know, we should really be trying to suggest to people that they don't dash out and get themselves a wood burner, particularly in certain areas of the country. So I was wondering when that would be likely to be materialising. And you were also saying that public health was contributing to a Calderdale food strategy. And similarly, I was wondering when that might be accessible, because obviously, although it's very important in young people, it's not purely an issue for young people. And having a well-coordinated strategy across the whole community would seem sensible to me.
Yeah, useful points, Councillor Hutchinson. Deb, do you want to come in on those points, please?
Yeah, Yeah, thank you, Councillor Hutchinson. So in terms of the air quality strategy, we have an air quality strategic group that's meeting. We've actually got a draft of the strategy that is going to the corporate leadership team on the 12th of July. So there's and for comment, and then through for a sort of a consultation process. So I mean, if this board would be interested in seeing the strategy and consulting, but being consulted on it, absolutely, that'd be incredibly helpful. The strategy does, Councillor Hutchinson, it looks at the main contributors to air pollution, and the two main contributors to the different types of air pollution are road motor vehicles, road traffic, and solid domestic appliances, actually, wood burners, but other appliances as well. So you're absolutely right, and it will include that. The framework that we're proposing, and it hasn't been anywhere other than the strategic group yet, but the sort of framework we're proposing for that is really thinking about what the council will do, and then making suggestions about what partners can do and what communities can do. Air quality is something that the council can make an enormous contribution to, but can't solve on our own. It's something that we all need to work together on. So when, as I say, we're taking it to the corporate leadership team on the 12th of July. So I'm envisaging there'll be, following feedback from that group. I'm envisaging some consultation over the summer, maybe into the sort of September time for that. But we can let you know a firm time at one of our, I can let you know what the timescale is. The specific timescale is after that meeting. In terms of the food strategy, I can see Councillor Courtney's got a hand up and she's got a real interest in food, but I'll just really briefly say that we are working. I've actually got a meeting early next week about the sort of timescales for that, but we're very much working with the Calderdale Food Network on that, and we are already bronze award on something called on sustainable food places. And we've got an aspiration through the Calderdale Food Network to get to silver. And in order to get to silver, we have to have a Calderdale food strategy. And we've set ourselves a deadline of about 18 months to get to that sort of silver level. So that will mean us developing that food strategy, in the next sort of 6 months to 9 months. And when I say we, it really is that food network that will be doing that. But again, I can let you know a firmed up timescale following the meeting I've got next week about that.
Thank you, Debs. I will bring in Councillor Connolly first. Sorry, Councillor Foster. It's just I think it's in response to the food strategy. So if you can keep your answer as concise as possible. I know you're very passionate, and we love your passion.
I will. Sorry, it was actually in response to the air quality. I think part of the job that we will have as councillors, all the way across, all wards and all councillors, is about that change of is that level of awareness and change of behaviour, and in helping and in encouraging our residents to go for that change of behaviour. If it's using your cars, using their cars less, using our cars less, and participating in active travel. And I think that I think. I'm not preempting what the strategy is going to say, but I'm pretty sure that's going to be a sort of fairly important part that we can all play as members.
Excellent. Thank you very much, Councillor Connolly. And we're doing our business tonight by staying at home and not driving our cars. Councillor Foster, I apologise for keeping you waiting there.
That's fine, don't worry. It was the question around healthy behaviours, really, and whether or not our public health department links in with the Yorkshire Smoke-Free Service and stopping. We used to have a very, very good stop smoking service in Calderdale, but that got kind of. Oh, for goodness sake! Sorry, I'm just being yelled from downstairs. It's so frustrating. Honestly, in-person meetings are a lot easier in some ways. So apologies for that. So yeah, I know we used to have very, very good stop smoking service in Calderdale before, and that was sort of limited in its effect because of lack of funding. I know we've got the Yorkshire Smoke-Free service, but I don't know how effective that is, and how do we as Calderdale work with that service to kind of make it as effective as it possibly can. If that makes any sense at all. I apologise for the interruption partway through.
Thank you, Debs. If you can respond to that, and can I just add on top of that, actually, because the effects of the e-cigarettes, because we don't know the impact that that's going to have. So whilst we're encouraged with more people stopping smoking, there is an issue, I think, with the e-cigarettes.
Yeah, thank you. Yeah, we still do have that stop smoking service. We stop smoking service for this area. It's beyond Calderdale. It's a larger service, but it's delivered. We have an element of it delivered in Calderdale, so we still have that stop smoking service. I think, and you're right. It's incredibly important, and what we've got is the prevalence of smoking, has reduced in society since we had the legislation. What we do have, though, is significant inequalities in smoking and in tobacco use. So the stop smoking alone, so sort of helping people stop smoking, is really important, but it needs to be part of a wider approach around what we call tobacco control. So that involves things like tackling illicit tobacco, for example, and also e-cigarettes. We don't know the long-term effects of e-cigarettes, but we pretty much know that they're a lot better for you than if you're going to smoke. It's much better for you to smoke e-cigarettes than cigarettes. We've actually applied to be a pilot for e-cigarettes through our Stop Smoking service, just again for tackling those inequalities. Really, we know that e-cigarettes can be, and cigarettes and e-cigarettes can be quite expensive. So again, looking at piloting e-cigarettes as part of the sort of agenda around tackling inequalities. Because we talked about it at the last meeting, that another key priority for us around tobacco is smoking in pregnancy. And that we've made significant progress actually through amazing work from our maternity services from our hospital, because it was shared at the last meeting. So we're making really good progress with that. So yes, really important, the stop smoking services, but it needs to be within that wider context of tackling tobacco more broadly, having smoke-free places, doing work to tackle illicit tobacco, and obviously supporting people to stop smoking as well.
Excellent, thank you, Debs. Councillor Shukaz, welcome.
Hi. Sorry, just a quick question, Debs. Just on the point, I was wondering if there's been any more stats come out around infant mortality amongst the BAME population, and especially sort of healthcare during pregnancy, because as I mentioned before in passing, and this is purely anecdotal, but there've been a far greater number of stillbirths amongst the BAME population in the last 2 years than there were prior to that. Thank you.
Thanks, Councillor Shukaz. Yeah, I don't know if there's been a new release of the data, but I'll definitely go away and look into that. I think I looked into it like when you asked me previously, so I'll definitely take that away and let you know if there's been if the data, I think last time we looked, didn't sort of reflect that period, but what we'll do is we'll have a look and see if there's been a new release and look at that. But I think that's really important intelligence and insight that you're sharing there, so it's something that we need to look into.
Thank you, Debs, and thank you ever so much for presenting this evening. I think it just shows your passion is brilliant. We love it. We really do, and I think we'd love you to be on board, and we want to work with you and scrutinise in the nicest possible way. So thank you very much for presenting tonight. Thank you, Councillor Courtney, as well for your passion. Is evident that you're natural to the role. So well done you. So let's move on to item number 6, which is the adult services and wellbeing priorities. So Ian, over to you.
Thank you, Chair. And can I just say thank you for your kind words earlier. It's very much appreciated. And it's been an absolute pleasure to work in Calderdale. And I think the 29th of July will be a sad day, because whilst I'm looking forward to my retirement, it will be a really sad day leaving behind some of the amazing people and work that we do in Calderdale. So thank you.
Pleasure.
I'm going to try and take you through the presentation that you already have had, but I'll try and bring some of the things we're intending to try to do, and I certainly will hopefully lay the foundations for this, and certainly the new director, when they come into post later in the year, will pick up this and make it their own. But I thought I'd kind of start with being really clear about some of the work that we've been trying to do, and I hope what you'll see, whilst we use different words, there's quite a lot of crossover between what Debs has described as a belief and philosophy around a vision for public health and population health into what I think we're talking about in terms of adult social care. So we were trying to find the most simplest way of not having millions of words on a page describing what our vision for adult social care is, but we wanted to talk to people who may need social care currently or in the future. So we want people to be able to live the largest life possible that recognises their individual aspirations and builds on their strengths, keeps their social networks alive, and that they feel connected to their communities. You'll have heard, people who have long-standing members of Scrutiny will have heard me say on a number of occasions that if we can tackle social isolation, we can help people stay connected to their communities and not see people as having deficits. People can actually meet and have really fulfilling lives. I think for too long, social care's often talked about deficits. So I hope that is the vision that will resonate with Scrutiny members, but also you'll see that move forward as the new director comes into place. Now, I thought I'd just kind of take you through some of the kind of key priorities as we see them. And one of the things I know that we need to do is, one of my statutory duties as a Director of Social Services, is that I have to ensure that there's high quality, sustainable social care provision. And the things that I think we will be focusing on this year, partly because there's some big pieces of changes to legislation around charging reform, but we will need to develop a sustainable funding model for social care. We want to continue to invest and grow extra care provision and supported living, and not just focus on either home care or residential and nursing care. And we're particularly looking to bring forward plans around the Todmorden site, which was the old Fernley Old People's Home, and we're still identifying a site in North Halifax around extra care. We want to really invest in community support, so getting those people to stay in communities, playing an active part in their communities and being economically vibrant for people with learning disabilities and people with dementia. And we will be bringing plans forward for work which will describe new ways of working, connecting to community hubs for people with learning disabilities and people with dementia. It would be no surprise that I'd be failing badly in my role as Director of Social Services, that in order to deliver all of this, we do need a sustainable workforce, both in terms of the council, but also our commission service. So one of the things that we're really keen to do is bring forward plans around getting really effective recruitment and retention into adult social care. And I'm really pleased that on the 11th of July, Cabinet will be considering a paper that will, hopefully, if passed, increase investment in the next financial year that will allow us to think about becoming an adult social care real living wage commissioner, where people will actually be able to get a real living wage for doing a really highly skilled job. And that, I hope, will mean that we'll be able to retain people in the social care sector. Because if we don't really focus on retaining the workforce, what that means is that people who have got current social care needs wait longer before they can get a package of care. And that will either mean the individual will deteriorate, or families who will have got other elements of their lives that they need to stay will have to step up to care. So getting this part of the strategy right is really important. And I'm sure all members of scrutiny will recognise the importance of getting that right. One of the things that I think that we still really need to really focus on as a directorate is making sure that we embed equality, diversity and inclusion in all that we do. So some of the things I'm intending to put in place before I go is we have a statutory duty to do something a little bit like the Joint Strategic Needs Assessment. We have to publish something called a market position statement that says to prospective social care providers, what does the social care market currently look like in Calderdale? What does it need to look like? And it's almost like our prospectus to people who might invest in Calderdale. But I think one of the things that I've recognised over my time in Calderdale is that increasingly we have very specific health and social care needs from the Black, Asian, and ethnic minority communities, and also our LGBT communities. And I think we need to make sure that our current provision actually is able and inclusive and can meet their needs. But also I think there were some opportunities to develop very specific services and interventions for those communities. We do want to, I'm acutely aware in my directorate that our workforce profile is predominantly white female. We need to encourage more men, more people from Black, Asian and ethnic minority backgrounds, and people who feel comfortable being their whole self in work in terms of their sexual orientation. We are going to do some work around refreshing our approach to commissioning and quality to make sure that we are really, when we commission services, we then actually really monitor them for how well they are doing or where they need to improve around equality, diversity and inclusion. And I think more importantly, in everything that we do, when we're designing a service, when we're thinking about changing a policy, we need to make sure that we use people with lived experience. Often a used term is co-production, but I think people who have got lived experience of social care need to be able to influence what that future direction looks like. And certainly in the work that we've referenced earlier this evening around burnt bridges, we will be working with people with lived experience to think about how do we develop work with people who've got really multiple complex and life trauma to make sure that adult social care can better meet their needs. We also recognise that we've got to get some of the basics right in what we do. And so we want to make sure that we do really have a workforce that can be strength and asset based. We will need to deliver some funding to change the current adult social care recording system. It's an in-house system that's probably well past its shelf life, but we do need to get a really good system. And often I get very passionate about strength-based and then I have to talk about IT, but without a good IT system, we can't really plan and deliver services well. Part of that work that I talked about, some of the charging reform, is that we know that the expected maximum outlay anyone will pay for care in terms of where they need to contribute to their financial assessment for an account is 86,000, but we'll need to start preparing the work for care accounts, which probably might be one of the reasons that I'm deciding to retire this year, because it's probably not one of my areas of strength. And I think we also need to make sure that we are ready for the new inspection framework that will be very familiar to people who have had children and young people's experience. There will be a similar inspection framework for adult social care. Adult social care has not had that kind of framework for at least 10 years, but within the year 23-24, CQC will be charged with delivering assurance processes for all local authorities with adult social care responsibilities. So I'm going to stop sharing, and that was a bit of whistle-stop tour, because I think the paper that's coming around early intervention is probably, I'd sooner we have more conversation around that real piece of work, but I'm more than happy to take any questions on what I've just described. It was a whistle-stop tour.
Ian, you've been fantastic on that. You know that I like short presentations, and equally with Des with the short presentation. So Councillor Josh Fenton-Glynn, please, first of all.
Yeah, just a couple of things to add on that. I mean, apart from the fact that I don't know what I'm going to do when I can't look at Ian in these meetings, and yeah, I think his unflappable nature is the kind of thing that you really need in this role, and I'm very glad that he's got two incredibly able deputies, because I think, you know, it's never a quiet week in adult health and social care, and it's really important that we do have, and I think Calderdale are very lucky to have an incredibly capable team to kind of deal with these things, because you know, whether it's kind of CQC or kind of individual people's cases, we have to be on it, and honestly a testament to Ian that we've got so many people who are so capable in the organisation. So thank you, Ian, although I don't want to give away the speech that you're leaving too soon. Yeah, just a couple of things. So in terms of, I'm not going to go into the pay stuff too much, because there's going to be kind of official announcements coming up, but you know, that's a really important thing, because at the moment, people who we expect to look after the people that we love the most are paid less than people that are starting in Nando's. And I don't think that anyone should be paid poorly, but we need to recognise that care work is skilled work, and we need to treat our staff that way, and I'm really proud that we're going to do so. One of the things that I really wanted to get through when we were talking about our priorities this year is that care isn't just elderly people. In fact, half of our budget is all age disability. And I think it's really important that we recognise that half of care, because otherwise I think people just have the wrong image in their head. And actually, you know, when you think about the importance of particularly our day services and our respite care and things like that, you think about families who spend their entire lives looking after loved ones that need that support, and, you know, kind of people who kind of end up in that position. So I think that's something that I think is going to kind of come through in our priorities. The dementia work's really exciting. I can't wait to tell you more about it, and, you know, kind of how we are going to do what we can to kind of lead the way. And related to that, you know, our kind of the way we're looking at our day services and making sure that they do what they're needed to do. Final thing I'm going to talk about is kind of some of the assets and, you know, the buildings. I've visited quite a few of them in recent weeks, just now they've let me out of the house post-COVID. I'm trying to make sure that I'm getting kind of around and speaking to people who are using our services as much as possible. But I'm also really, really happy to say that that I believe tomorrow Railway Bridgeview will be finished. To give you a bit of context, it was due on the same day that my son was due, which was the 29th of October, and he was a day late, and he's 8 months now. So yeah, it's been a tricky project, but I'm really glad that we're getting there. And actually, for all of that frustration that I have about it, it's such an amazing facility, and we've talked about it before, but I'd really like at some point to get an opportunity to show you around some of the kind of adaptations, particularly in terms of the dementia stuff. So quick whistle stop tour, but you're welcome to ask other questions.
Thank you, Councillor Fenton Glynn. I was just about to raise the railway view and see when we could actually visit the place and actually see more inside. So hopefully we will get to see that. And certainly we look forward to working with you and also holding you to account as well, you know, on occasion. So we'll. I'm sure Councillor Barnes and myself will be having a meeting with yourself to go through some of the other things as well shortly. So I'll bring in Councillor Hutchinson at this stage, please.
Thank you, Chair. I'd also like to say how refreshing it's been to have a director of adult social care who's got such an obvious grip on his brief and produces a great sense of confidence. I'm really welcome any move that Calderdale can make towards embracing the ethical care charter. And so, you know, a move to a real living wage employer or contractor or whatever is extremely welcome. But in terms of retaining staff, some people are happy to stay at one particular level, but other people do value developing themselves, developing their skills, and being able to progress to the maximum of their ability. What role do you see Calderdale in playing in? You know, I know some of that will be through other employers and other bodies, but what role do you see Calderdale as having in promoting the development of our care staff and making people realise that it can be a career for life?
So prior to bringing Ian in, I think Councillor Fenton Glynn probably wants to make a comment about your comments.
Yeah, I mean, I'm not going to jump on any announcements about kind of ethical care charters, but we're thinking along very similar lines. In terms of what we're doing, though, it is important that we recognise the kind of careers in care. And actually, one of the things that we're really pushing with the package of measures is making sure that actually training in career pathways is part of it. It's always going to be difficult because the NHS will always have, well, until, and I don't want to get political, I know that, you know, that's not the thing here, but until the government step up and properly pay and give terms and conditions to care staff concurrent with the NHS will always have better conditions. And so, you know, unless we recognise care as part of the health service, which we should, then we're not, you know, that we will lose staff to the NHS, and that's going to happen. But what we can do is we can make the training good and make it popular so people can see those career routes. So, you know, so we get people that are committed to improving their skills. And that's going to be a real kind of key part of the, I hate using the phrase package of measures, the bunch of stuff that we're going to bring through in the cabinet paper that's tomorrow is kind of looking at that training and that support as well.
Thank you, Ian. I'll bring you in at this stage.
Thank you, and thank you, Councillor Hodges, for the question. I think Josh has alluded to the fact that we are going to bring some things that I think hopefully will address some of those things around the ethical charter. And certainly I think some of the work that we've been doing the last few years around really investing in training of the wider workforce would make that transition to becoming an ethical employee into standing up to any such charters will be quite an easy transition. I think one of the things that I've been quite committed to, so I, as part of the Association of Directors of Adult Services, I chair the Yorkshire and Humber Regional Workforce Programme. And so we're developing a workforce strategy for Yorkshire and Humber that really talks about a kind of social care progression pathway, recognising that there are some people who really enjoy their job and want to do the best job at that level, but also give people opportunities to kind of try different areas of social care, but also maybe using it as a way of moving on to other managerial roles or into social work or vice versa. But I think increasingly, what we need to do is work with health colleagues to have an integrated people strategy. So I've been working with the new West Yorkshire ICS Director for People and Workforce, Kate Sims, just to start thinking about what does that look like in terms of a more integrated workforce people approach. There certainly is a lot more money and opportunity that comes through the NHS. And I think that we're at quite an important point where I think the NHS does recognise that without a resilient, well-trained and supported social care workforce, the NHS will come under constant pressure in a way that it won't be able to cope with if you don't have that in place. So I remain optimistic that I think we will have a much more integrated approach, and I think there'll be a lot more collaboration on that front.
I share your optimism. Thank you, Ian.
Thank you, Ian. Councillor Foster.
Thank you. I just wanted to share a little bit about my daughter's experience, who's worked in care but no longer works in care. She found it was incredibly tough growing, long hours, poor pay, understaffed, constantly understaffed, and constantly be called in on her days off. And I said, what would have made you stay in care work? And she's replied, better pay, more support, more staff, no unreasonable expectations. So if you're working a shift and you're already 2 people down, and the manager's yelling at you, why haven't you done all the cleaning jobs you're supposed to have done? Well, how? So that sort of thing. Career progression onto something other than management, and guaranteed days off. So not working more than sort of, say, 3 days in a row without having a day off, something like that, because you're talking 12-hour shifts most of the time, sometimes longer than that. And I think that sort of thing, and that sort of thing would be really helpful in looking at why we've got such a poor retention rate for carers, particularly working in care homes. I'm not so sure about what the retention rates are like for mobile carers, if you like, the ones that do home visiting, but working in care homes, it was just incredibly tough. And the other thing, she's come up with even more, she's sending me a list as we speak. She said no 0-hour contracts, buses that run in accordance with shift times, so you're not having to spend 2 hours wage to get to work on a Sunday morning because you can't get a bus that gets you there. Transport other than taxis to get to work on a Sunday, more breaks so you're not on your feet so much, so you have, you've got at least 15 minutes every few hours, something like that, and dedicated time to do paperwork. All of those things, it's not, none of those are particularly unreasonable. They're not, you should not ask in the earth. It's just making the job actually doable and sustainable. Because at the moment, the way things are run, everywhere is the same. It's all short-staffed. There's huge amounts of pressure on everybody. It's not management's fault that they're sort of saying, please, can you work your day off again? Because they just don't have the staff to do it. So looking at all of those things, and I'm very happy to send that list on to you by email, if that would be helpful. Looking at all those sort of things just would, I think, really help to increase the retention of staff. But yeah, I think pay is a big thing though. It's really hard work and it's really badly paid in the general scheme of things. And it's no wonder people would want to go and work in a coffee shop instead, because it's hard work, but it's much better paid and nothing like as difficult. So yeah, I'm recognising that it's actually really skilled work. But anyway, I'll stop going on. Thank you very much.
No, thank you, Councillor Foster. That's really extremely useful. We like to visually see things, and that's visually seeing something, and actually on paper, you're inclined to bypass it. Actually, that's a real story, which we do like to hear, if that makes sense. Right, Councillor Barnes.
Yeah, I don't know whether Ian wanted to come back on those points before mine, or do you want me to go on to mine?
If you just go into yours, then Ian will store that in mind, I'm sure.
Okay, that's fine. I think there's 2 aspects of what I wanted to say. And I think we for those who were on the children's safeguarding presentation yesterday. Obviously, there's some serious concerns about the super profits, the abnormal profits being made in that sector, and some of the concerns there. And I think it's great to see that we need to be doing perhaps a multi-tasked approach, or a multi approach in terms of adult care. The genie with regard to private companies is out the bottle, but I think as a council we need to look at our options available to us to develop our own facilities even more so. But I suppose the key question to Ian is that this is his opportunity tonight. What is his greatest concern for Calderwood adults over the next 2 to 3 years? What is the big risk, that what's coming over the horizon that we might not be aware of, but could be the biggest, I suppose, blocker to any plans that we have?
Thank you, Councillor Barnes. Ian, over to you.
Well, thank you, Councillor Foster and Councillor Barnes, for giving me the opportunity to kind of say what it is. And it is really interesting when you come into the end of your career, you do suddenly become unfettered in your approach, because actually what can people do to me in 21 days?
Howard, you might want to get the mute button ready.
Yeah. So I am somebody who started his first adult social care job at the age of 17 working in the care home. And I've now worked in social care for 39 years. And people often said to me in my career that you don't do this for money, you do this for love. But in reality, we do need people to be able to be paid a decent wage. So some of that of the list that Councillor Foster read out is, I think it's really imperative that we understand that people need to be given a decent rate of pay for doing a really complex job. And some of the crises that we have in terms of retention, people leaving social care, even though they think it's a really valuable role to play, is because people are paid a lot more to do other things. So we've got a position where we've got really high inflationary salary uplifts in other sectors because of the B word, because of Brexit. So you'll see things like Amazon employing packers $14.50 an hour. So the national living wage, which a lot of social care workers is currently £9.50. But if I can earn £14.50 packing gifts with more regular shifts, the ability to know when you're going to get your days off, then that's always going to be more attractive. So if we don't sort out basic pay, that's always going to be a struggle. And I'm going to be really proud of Cabinet when they make that additional investment. But actually, this is more than a local or a regional solution. There does need a national investment in funding appropriate adult social care. We do need to make sure that there are career pathways, and we do need to make sure that they get the right training support, because actually we are losing really skilled, passionate people because of this. And I think we have to tackle that bit first. So, Councillor Foster, please send me a list. But I think I sadly know all of those things that are on the list, but hopefully some of the plans that are going to come forward on the 11th of July will make a really small step to addressing that. But I would encourage every member of the scrutiny panel to really use all your political influence to think about how do we lobby and influence to get the adult social care issues on the political agenda. The current reform agenda largely focuses on what people may have to pay for their care, and that's critical. But actually what we need is a sustainable funding model that will make sure that people can have a decent salary, they can guarantee that they get the care when they need it, and there'll be a consistency of carer. And actually at the moment, that's my real worry, that we are not entering into a position where we know what the long-term financial stability of adult social care is. So I'm going to stop there, because I suppose technically people could still sack me with 21 days to go. But I think this is an area where we should be really agitated about, because actually we all will all need contact with social care at some point, and getting this right is really important.
Excellent. Thank you, Ian. I think as a panel, we'd love you to be our critical friend in the background, even when you do retire, because the knowledge and wealth of knowledge that you have, I think it will be extremely a great loss to lose all that knowledge. So therefore, I'm opening up the invitation to you to actually take part and be a member of the public almost, but actually a very important member of the public that can add extreme value to help us do our job that we need to do. So that's why I would put the challenge out to yourself.
Yeah, I think there's probably that poacher tame gamekeeper role, isn't there, somewhere here?
Super. Right, members. So thank you, Ian, for the presentation. Extremely useful, and everyone's contribution. We'll continue to work through the year. So we now go on to item number 7, which is early help and prevention. So Sean, welcome, Sean. You've been patiently waiting there. So over to you.
Thank you, Councillor Blackburn. Just to say that I forgot nearly that I was about to present this paper because I got so engrossed in the conversation that I had to wake myself up and get back to the reality of what I've got to do now. And also just to say, just to start Councillor Fenton-Glynn's point, that there's never a quiet week in adult social care or for the council, in the council for that matter. That's my one ambition before I retire, whenever that may be, that I could have a quiet week. But I'm sure that's never going to happen.
I don't want you thinking about retiring, Sean.
Yeah, be a while off. Yeah.
Never ever use the Q word.
That's absolutely true. When Debs and Ian were presenting their parts, I kind of completely changed my notes, but as I was writing them and thinking about the report, I put the words synergies and common themes. And I think what's really affirming and hopefully quite heartening, and this is genuine, is that public health and adult social care work really, really closely together operationally now, really closely together. A good example being Burnt Bridges and the work that Niamh and I and other colleagues are doing around developing, because we've been given the permission by Ian and Debs to shape up what we think based on the recommendations, and bringing other colleagues in right across the council and with partner agencies as to what a good preventative model would be, so we never get into that place again. And particularly for those poor souls that lost their lives because there weren't services in place that could detect that sooner rather than later for them. But I was thinking of synergies and common themes because throughout the report that I've drafted, I've written, the language is more or less the same in terms of the strategies, for instance. So everything that Ian has inculcated within me, quite rightly, and what I'm trying to do within the staff group that I lead and manage, is to make sure that the priorities that he's listed is embedded into the practice that we're doing all across the 3 key services that I manage: early help prevention, personalised long-term support, and all age disability. And we've got a way to go with it, in truth, but we're starting to really motor, and we have been since the last report that I gave regarding early intervention and prevention last year, about a year ago. And what we've made sure, and what I'm trying to do now, is that the visions around aspiration, the closer working relationships with the Staying Well programme, the technologies that we can use to support people in the community, so that they can use those technologies to be safe, to improve their well-being, but also to have that level of support that they need from the council as and when they need it. To make sure that as far as the work that we're doing, which is now kind of gathering more steam, and we're calling it the discovery work, is about really understanding why people are contacting adult social care and wellbeing services, and getting a real feel about how we can direct and kind of ensure that the right information and advice, and if need be, support is given to people. And that we're working with all the agencies across the community. So for instance, Deb's talked about community anchors and the numbers of community associations that colleagues, social workers and assessors, OTs are now beginning to work with are thinking more of working with across the community, really, so that when calls are made, and Ian's talked about strength-based approaches, and we're going to have a programme of that for all staff, again within across the directorate, and particularly within my directorate, where there is front-facing conversations going on every day. People can really understand, the workforce, I should say, can really understand what people are saying, and that they're properly listening, and that they understand what's out there in the community, so that they can direct them to the right places. And where they can't, and where there needs to be commission support, that support is given. And that there is a range of choices for that support that can be commissioned. So again, in terms of what Ian was talking about as far as the longer term priorities for the directorate, everything that my part of the world in terms of early intervention and prevention and feet on the ground across the community is about trying to actualise that, and coming back as well to say that, you know, when social workers have conversations and they're struggling to actually answer some of the questions because we don't have the services in place or we haven't thought about that, we can have good, quick, informed conversations about how we can develop those resources within the existing capacity that we've got, so that there are more rapid conversations now taking place across the system. What I'm making sure as well is that the vision and priorities as outlined are kind of built into everything, so that we understand when we're working with people that we're trying to help them become healthier. And again, using quite a lot of the approaches that Debs has outlined in her presentation around public health, and that people are moving away, becoming more resilient in terms of our early intervention and prevention approach, and not defaulting to care and becoming reliant on care. Because we'll never be in a situation to ever kind of meet that demand. Particularly since COVID, and with the cost of living crisis, what it's allowed us to do as well is focus. Actually, we've been looking at the kind of potential opportunities from those two crises in terms of how we can kind of focus with the community on what their needs are, but how we can address them differently. And what I'd like to do as well is just kind of point you to page 34 in terms of how that's been actualised. That's page 6 on the report, sorry. And in terms of what we're doing, what we are now starting to kind of bear down on is to make sure that every conversation, regardless of the person's needs and their complexity, is about promoting their independence. And where we're struggling to understand how we can do that, we come back as a workforce to kind of work it through and bring other partners into that discussion. And I've also kind of mentioned it already, you know, how assistive technology and other types of support or advice can help with that. But we are becoming more integrated. So as far as some of the discussions that were outlined earlier on about a more integrated workforce, our reablement team, which is part of our early health and prevention service, is now, or some elements of it in terms of the urgent care and response team, is an integrated team, and they are working to the same salary scales as health colleagues with some additional tasks. But they also have a career grade. So in terms of that discussion about how can we get people into the workforce and keep them there and nurture their talents, we're beginning to do that already, and that's just the beginning of the journey. What we've also got and what we're working on, and Ian has touched on it in terms of the new adult case file recording system, is also the add-ons that we can have that a lot of people would like to use instead of speaking to us to make us more efficient. So for instance, we're going to be very imminently now, at last, relaunching Live Well Calderdale, which hopefully with public health colleagues and with children's services and with health as well, it will be the main directory of services and advice that people can access very quickly. And we're also looking at portals, digital portals for online assessments, certainly as far as financial assessments are concerned. And again, going back to Ian's point about care accounts and so on, giving people more of an understanding of what they might pay if they are receiving or might be receiving care and support services from us. but a whole range of technologies that people can use, access for advice, information, support, that's at their fingertips, literally, in terms of how it is for us in more mainstream areas. So it becomes the default in terms of how we work, but people can also speak to us as and when they need to, and they are in need. And also making sure that the quality of information that we've got is good, and that particularly the self-directed support, so the personal budgets and the direct payments that we offer to people, it gives them more choice and control than they have before. And that more people, again, with learning disabilities, mental health problems, particularly with the work that we're doing around ISGAL, can access paid employment opportunities. And again, there's a whole range of work that we're, or projects that we're bringing together now as a cohesive whole that will form part of the Learning Disability Employment Strategy, that will be all about people accessing vocational opportunities, the redesign of ISGAL, and how people can get into paid employment, be that in the private sector or public sector, in CHFT and the council. So there are many more bits, but I think the most affirming bit as far as this report is concerned is how, even without having to have conversations before scrutiny meetings, colleagues are working together using the same language, but importantly, now working together to try and make a difference. And I think as the next few years roll on, we can start to report the tangible outcomes and benefits of those. So it's not necessarily just words on a page or on a presentation, but we can show the metrics in terms of the changed quality of life and the numbers of people, as Deb was saying before, that we're working with, that is moving from a kind of individual one-off, well, not one-off, but small numbers to a much broader number in terms of the population, and particularly for those people in most need, such as those with complex street-based lives, as one example. Thank you.
Thank you, Sean. Yeah, thank you. That's really helpful. And the report was extremely comprehensive. I think one thing that we need to be wary of is that we rely on everyone being able to use technology, and I think there is a gap there. And I think we need to somehow look into how we can fulfill or how we can fill that gap, so that actually people can look online to what services are available for when they do need them. You know, so it's something that I think it's wonderful that we can use technology, and we can use like assisted technology for older people and those that need the actual care itself. But we just need to be mindful that it's not just straightforward on that one. Ian, do you want to come in before bringing Councillor Barnes in?
I think that whole thing about making sure that we're not, as we develop things like self-service, we're not by default then excluding some people that might not be as au fait with digital. And I'm not assuming that might be older people, because I think I've seen some amazing older people who can probably teach me a thing or two about managing a website. But I think there's something about making sure that where people feel confident and skilled about using a digital platform, and that's the way that they want to access, let them. But we'd always then need to make sure that that means we've got a telephony service that allows people to talk to somebody on the phone. We can do face-to-face conversations. So I think it's a blended approach for in my view. It's not either you have it this way or you don't have it at all. It's making sure that we have a strategy that is inclusive of everybody.
Indeed, thanks, Ian. Sean, do you want to come back on that one?
Yeah, it was just to clarify that and reinforce Ian's point, to be clear that absolutely it's not about one channel shift that would be more digital than ever, but this is about making sure that so we've done some work already, that there are some people, and a growing number of people in the community, that like to access services online. That's terrific, that's great, but absolutely, as Ian has said, there are a great number of people still who want that personal contact. So it's how we're managing our demand, which is ever greater than ever, with its complexity, but making sure that those that want to do it online, absolutely terrific, but those that need that call with us have that call, because that's the most important thing, particularly if they're in a situation of need or crisis.
Yeah, excellent. Councillor Barnes, thank you for that, Sean.
Thank you, Chair. I was just enjoying the Sean and Ian tete-a-tete, a bit like Smith and Jones for those of a certain age. Unfortunately, not as funny, but there we go. Can't have everything in this life, can we? I think I just want to pick up on something which is really, I suppose, and I noticed your comment in 2.6 that half the requests go, but for those that don't, that go in, especially in early intervention in the system, what are we doing to keep that movement along? And I'll call it a process, I'll call it a system, moving along that timeline. How are we integrating within that so that thank you, Councillor Fenton Glynn, but you know, I'm not going to pay to watch you at the Edinburgh Fringe. But how are we processing them through the timeline to make sure that they're not having to repeat the same things time and time again? And I think that's one of the biggest issues when you speak to people. It happened with my father. Is my mother would have to tell somebody else what was going on. This wasn't in Calderdale, this was in another county, so I can tell that story. But it's just how, from early intervention, do we ensure that individual doesn't have to, because we know what's going to happen in certain situations. We don't know when it's going to happen, but we more than likely know it's going to happen, particularly with regard, let's say, to dementia. People presenting with dementia, we know they're not going to get any better. Does that make sense?
Thank you, Councillor Barnes. Ian, I think you indicated you wanted to speak first.
Thank you. And Councillor Barnes has hit the nail on the head. And I think one of the things that I hope that we will be doing when we're thinking about our remodel, so particularly with people with dementia. And I was in a conversation with Sean and Councillor Fenton Glynn and other colleagues a few hours ago, where I was really pushing on the boundaries around dementia. And so when somebody gets a really early diagnosis of dementia, I think it's incumbent on us to do what I call future-proof their support plan. And I think what we tend to do is deal with the here and the now. And it's likely that someone's journey with dementia will differ greatly. And what we can't predict with accuracy is when those things will happen. But if we know the type of dementia that somebody's got, we can probably make a really good guess at what that pathway is going to look like. And if we can equip people with a plan that means they don't have to tell their story again or feel they've got to a crisis point where they then have to almost look for services, rather than having a plan that says, if you start to experience X, this is what you need to do, and this is how we'll bring those services in. So I think there is something about the way in the DNA that we'll work going forwards that will stop that kind of episodic, you come, we give you something, then we wait for the next crisis. So I think there is something about us planning for the future and not over-prescribing, but being clear about when it's necessary, that thing that will be really helpful can come online quickly without having to go around the houses.
Excellent, thank you, Ian. Sean, do you want to come back on that as well?
Yeah, please. You've hit it on the head, and it's almost not the holy grail necessarily, but one of the key things that adult social care services still need to get right. It's about making sure that we don't have or don't compel people to have multiple conversations. And having experienced that myself, I get it. I completely get what you were saying there, Councillor Barnes, and it's a real driver for me to make sure that's the case. And I think where we can get closer to getting it right, to addressing it, is, again, something that Ian touched on earlier, is the implementation as soon as we can get to it, and it will be over the next 2 years as we work towards the social care reforms, of a new case file recording system, so that because it's not fit for purpose now as it is, and it will be a new one in one way or the other, when conversations are had, then if a further contact is made by someone in the system and their journey has moved on to some extent, the information is already there and it doesn't have to be repeated. And in the way that other organisations work, you can get into the conversation straight away and not have to spend so much time going through your history again, because it's already there on the system, and you can start to move on with the next piece of work to support that person to stay independent. So that will be the key kind of theme of the redesign work when we start to do the new system.
Thank you, Sean. Councillor Josh Bentinglin, please.
Yeah, I mean, I think that's a really important thing to get, is the not letting people making them tell the story again and again. And actually, it came up in the Burnt Bridges stuff, actually, if you get people, when they come to services, don't make them jump through every hoop every time. So I think that's really important. So yeah, the Burnt Bridges thing, I think in terms of our multidisciplinary teams, we are getting better at doing that. And then kind of on the other end of things, part of when we develop our Dementia Centre of Excellence, we need to look at those user journeys. We've got, in Calderdale, we're very lucky to have the Support in Mind team who work with families of people with dementia and kind of help them through the process. I think those kind of things is, people who are used to navigating that process, doing it with families, makes a real difference. So, we do actually do some quite good work on that in Calderdale. But I wouldn't say that, we could probably, people in Calderdale don't face the same experiences that you do, because, I know from my casework that these things do happen. So I think it's a perfectly fair cop. It's something that we are constantly trying to get better at, but please keep challenging us on it.
Thank you. Councillor Hutchinson, please.
I think Ian's partially touched on this, but with Burnt Bridges, it became very apparent the number of people that were signposted to services, and then and it was assumed that they would follow the signposts. I really would like to know that the redesign that's going on in the prevention and early intervention means that there is a definite review as to whether the measures that have been suggested or provided are actually addressing the issues and the needs that individual has approached the service from in the first place, that there is built in a review to see, well, if, so that you can say, well, if that isn't actually working or that service didn't tick the right box or whatever, is there something, do we have a plan B? Or is everything now hunky-dory and nothing, and we can say bye-bye?
Thank you. Ian, do you want to come in on that?
Yeah, I kind of think if somebody gave me 3 wishes in the next 21 days before I go, one of those wishes, you probably guess what one of the wishes is, that we actually have enough money to deliver good social care. But I think I've said that already. The second one would be that we almost learn to take out of the dictionary signposting. Because actually what we need is to be able to connect people to something. And sometimes that means a real person wraps their arms around the person who's struggling and takes them somewhere that can help them navigate the system. And sometimes we assume that people at the most lowest point in their life will suddenly be able to take in everything that's been given to them, and they just say, go there next Thursday at 7 o'clock. And actually, all those things that still go on in people's lives that are quite chaotic will probably mean that person will never get to that place at 3 o'clock. At 7 o'clock on the Thursday. But actually, if somebody physically meets them, takes them, and connects them, then we'll know that they've made that connection with that service. So my second wish, I won't tell you what my third wish is until my leaving do. But my second wish is that we ban the word signposting, and what we're talking about is being able to point people, connect people to those things, and there's sometimes that about putting your arm around them and taking them to it.
Thank you. I was hoping that one of your wishes, you were 10 years younger, that you could work for the service for another 10 years, but no wishful thinking. Sean, would you like to briefly come in? Because I know that I'm just conscious of time and members and things. So yes, please.
No, yeah, it was just to say that we've been very mindful of that as we've been thinking about the complex lives, the MIAM model, and it's a title, but we've been thinking really about what that means. And it's someone who's a community navigator, because people constantly, as Ian has said, disengage, particularly if they have very chaotic lives and they've suffered trauma. And having one person consistently to help them navigate through the system, and if they don't turn up at 7 o'clock on a Thursday, then they can find them or be there the next morning to go through it again, is the way that we're thinking that we need to go, not just with that group, but in terms of making sure that it isn't about signposting and it's a proper direction for someone and they get something at from the receiving end of it.
Thank you, Sean. A really useful report. So thank you so much for coming and presenting that. I think it's some food for thought that we need to focus on a number of different things there. So thank you for that. So we now go on to the work programme that has been distributed. I'll let Mike sum up in 30 seconds on this one.
Thank you, Chair. I just wanted to mention the session about primary care that members asked for at the last meeting. We're working hard on getting that sorted out and getting all the people in the room that we need to have there. I should have mentioned that Bella couldn't be at the meeting this evening, under apologies, but I forgot that. But Bella's doing all the work on that and doing a great job. I'll not mention everything. The dementia work that Councillor Fenton Glynn talked about, we've got an item on the work plan on dementia that, to be honest, isn't very well scoped at this stage. So I'd welcome the opportunity to talk to Councillor Fenton Glynn and Ian or Sean or whoever's appropriate about that to make sure. When is it? Well, it's scheduled for next month, but I'm not sure that timing is right. But if we could have a discussion about that at a later stage, that'd be really great.
Yeah, if you pop it back a month, we should have some more concrete plans.
Just the other thing to mention is that the next meeting is actually not in July but August, and we've run up against a holiday problem with Robin Tuddenham and Neil Smurthwaite being away that date. So we may, as you know, the CCG has about 4 hours left to live, and we were going to have a governance update in August, but some of the key people will be away. So we just need to think about the timing of that agenda. So that's all, Chair.
Excellent. Thank you, Mike, for that. So I think that's. I think that concludes the business of today. So it is with great sadness, Ian, that we won't see you either in person. Well, we will see you in person on your leaving do, but we will see you in our meetings that you've added so much value to our scrutiny panel. So once again, a big, massive thank you for all the effort you've done over the years for Calderdale and the people out there in Calderdale. So yeah, well done. Yeah. Excellent. Members, I'm going to conclude the business of today. So I hope you enjoy the rest of the evening and the weekend. So thank you very much for your attendance. Thank you for your contributions as always. And I say enjoy the rest of the evening and the weekends. So goodbye.
Bye.